Welcome to my YouTube channel, Radiology MCQs. Question number 1. Electrons interact with dash to produce X-rays. A. Focusing cup. B. Filament. C. Stator. D. Target. Answer is D. Target. Question number 2. Imaging the movement of internal structures is known as attenuation, photo emission, C. Absorption, D. Fluoroscopy. The answer is D. Fluoroscopy. Question number 3. The X-ray interaction responsible for absorption is A. Differential, B. Photoelectric, C. Attenuation, D. Captain. The answer is B. Photoelectric. Question number 4. Silver halide crystals are found in the film's dash. A. Base, B. Supercoat, C. Emulsion, D. Anticoil layer. The answer is the purpose of using automatic exposure control device with film screen imaging is to control KVP, BMA, density, D contrast. The answer is C density. Number 6. Poor film screen contrast results in loss of A energy, B contrast, C recorded detail, D speed, C recorded detail. Number 7. The purpose of intensifying screens is to A. Increase radiographic density, B. Increase recorded detail, C. Decrease recorded detail, D. Decrease patient dose. The answer is C. 8. Which of the following increases as collimation increases? A. Density, B. Scatter production, C. Fog, D. Contrast. The answer is D. Contrast. Question number 9. Shape distortion can be created by A. Angling the CR, B. Decreasing the SID, increasing the focal spot size, D. Increasing the OID. Answer is A. Angling the CR. Number 10. Which of the following defines attenuation? A. Absorption and scattering, B. Absorption only, C. Scattering only, D. Capturing electrons. Answer is A. Number 11. X-rays have dual nature, which means they behave like both A. Atoms and molecules, B. Photons and quanta, C. Waves and particles, D. Charged and uncharged particles. Answer is C. Number 12. The wavelength and frequency of X-rays are dash related, A. Directly, B. Inversely, C. Partially, D. Not. Answer is B. Inversely related. Number 13. X-rays have dash electrical charge, A. Positive, B. Negative, C. Alternately positive and negative, D. No charge. Answer is D. Question number 14. The X-ray beam used in diagnostic radiography can be described as being A. Homogeneous, B. Monoenergetic, C. Polyoenergetic, D. Scattered. Answer is C. Polyoenergetic. Number 15. X-ray were discovered when they caused a barium platinocyanide plate to A. Phosphoresce, C. Phosphoresce, C. Vibrate, D. Burn and redden, A. Fluoresce. Number 16. X-ray were discovered in experiments dealing with electricity and A. Ionization, B. Magnetism, C. Atomic structures, D. Vacuum tubes. Answer is D. Vacuum tubes. Number 17. Which X-ray tube component serves as a source of electrons for X-ray production? A. Focusing cup, B. Filament, C. Stator, D. Target. Answer is B. Number 18. The burning or boiling of electrons at the cathode is referred to thermionic emission, B. Space charge, C. Tube current, D. Cloud emission. Answer is A. Thermionic emission. Number 19. The unit used to express tube current is A. Milliampere MA, B. Milliampere seconds, C. Kilovoltage, D. Exposure times. Answer is A. Milliampere. Number 20. Which primary exposure factor influences both the quantity and quality of X-ray photons? A. Milliampere, B. Milliampere seconds, C. Kilovoltage, D. Exposure times. Answer is C. 21. What percentage of the kinetic energy is converted to heat when moving electrons strike the anode cathode? A. 1%, B. 25%, C. 59%, D. 99%. Answer is D. 99%. Number 22. The intensity of the X-ray beam is greater on A. Cathode side of tube, B. Anode side of tube, C. Short axis of the beam, D. Long axis of the beam. Answer is A. Cathode side of the tube. According to the line focus principle, as the target angle decreases, D. A. Actual focus spot decreases, B. Actual focus spot size increases, C. Effective focus spot size decreases, D. Effective focus spot size increases. Answer is C. Number 24. The process whereby a radiographic image is created by passing an X-ray beam through anatomic tissue is known as A. Attenuation, B. Photoelectric effect, C. Captain, D. Differential absorption. Answer is D. Differential absorption. Number 26. The low tree density areas on a radiographic image are created by dash A. Transmitted radiation, B. Scattered radiation, C. Absorbed radiation, D. Primary radiation. Answer is C. Number 27. Development and processing of an exposed film will result in a manifest image, B. Latent image, C. Invisible image, D. Inert image. Answer is A. Manifest image. Number 28. A radiograph that needs no improvement is defined as A. Unacceptable, B. Optimal, C. Inadequate, D. Diagnostic. Answer is B. Optimal. Number 29. Factors that affect the visibility of a radiographic image are known as A. Resolution, B. Geometric, C. Densitometric, D. Photographic. The answer is D. Photographic. Number 30. A radiograph that has insufficient density will best be described as A. Overexposure, B. Underexposure, C. Underexposure, D. Underdeveloped. The answer is C. Underexposure. Number 31. Which of the following is equivalent to doubling the MAS? A. Half the film screen speed, B. Half the OID, C. Double the SID, D. Increase KVP by 15%. The answer is D. Increase KVP by 15%. Number 32. What is the relation between milliamperage and exposure time to maintain density? A. Linear, B. Inverse, C. Proportional, D. Direct. The answer is B. Inverse. Number 33. A radiographic image described as having many shades of gray would be A. Low density, B. Low contrast, C. High density, D. High contrast. The answer is B. Low contrast. Number 34. Radiographic contrast can be increased by A. Increasing MAS, B. Increasing KVP, C. Decreasing grid ratio, D. Adding contrast media. The answer is D. Adding contrast media. Number 35. Decreasing the OID with dash. A. Increase on sharpness, B. Increase distortion, C. Increase magnification, D. Increase recorded detail. The answer is D. Increase recorded detail. Number 36. Increasing the SID will A. Increase on sharpness, B. Increase distortion, C. Increase magnification, D. Increase recorded detail. The answer is D. Increase recorded detail. Number 37. A grid should be used whenever the anatomic part size exceeds 3 cm, B 6 cm, C 10 cm, D 12 cm. The answer is C 10 cm. Number 38. The air gap technique uses an increased dash instead of a grid. A KVP, B MLS, C SID, D OID. The answer is D OID. Number 39. The fixing agent used to clear the underdeveloped silver halide crystals is A. Aluminum chloride, B. Potassium bromide, C. Ammonium thiosulfate, D. Sodium sulfite. The answer is D. Number 40. Typically, as screen speed decreases, dash decreases. A. Density, B. Recorded detail, C. Patient dose, D. X-ray exposure. Answer is A. Density decreases. Number 41. Changes in subject contrast are affected by changes in A. Film screen contact, B. Tissue atomic number, C. Beam quality, D. B and C. Answer is D. B and C. Number 42. A phototime chest unit consistently produces dark PA radiographs. The most likely reason for the change is A. The backup timer is set to short time, B. Patient is misposition of the AEC ion chambers, C. The calibration of the left and right phototimer detectors has changed, D. The backup timer is set for too long. The answer is C. Number 42. Number 43. All of the following factors cause non-uniform radiographic film density except A. Hill effect with 14 by 17 film, B. Use of high ratio parallel grids for short SID, C. Inverted focus tube, and size D. Number 47. 44. The sharpness of a radiograph will decrease when A. Switching from a large to a small focus port size, moving the X-ray tube of a C-arm, changing from single to three-phase. The answer is B. Number 45. The following change is least likely to reduce motion or sharpness in a radiograph. The answer is B. Number 46. The rotating anode gives A. Smaller effective focus, B. Better controlled exposure time, C. Less soft radiation, D. Mechanical rectification. The answer is A. Small effective focus and large heat loading capacity. Number 47. In a diagnostic radiograph, the process mostly responsible for differential attenuation is coherent scatter, B. Cupping interaction, C. Photoelectric interaction, D. Pair production. Answer is C. Photoelectric interaction. Number 48. Low contrast detectability refers to the ability of a system to distinguish dash as an example. The answer is A calcified. The answer is B, a non-calcified long nodule. Number 49. Geometric magnification can improve detection of high contrast objects. The limit on useful magnification is, the answer is A, boring due to focal spot size. Number 50. Methods of assessing spatial resolution of an image system include all of the following except A, bar patterns, B, step wedges, C, wedge mesh pattern, D, hole pattern. Answer is A, bar pattern. How many did you get correct? Please write in the comment section. Thank you for watching. I wish you success in your examination. Please kindly subscribe to the YouTube channel. Thank you.